Here I am Dr. Noslidi. Some of the MCQs are being explained here, which were given recently to the second internal assessment for second MBBS students. First question is, the 12-year-old soccer playing girl began to limp after limb twist while playing. She has pain in her right leg and right upper thigh, and the temperature was recorded as 102 degrees Fahrenheit, quite high temperature. X-ray of the femur reveals that the periosteum is eroded and suggestive of osteomyelitis. And the blood culture yields gram-positive bacteria, the most likely etiological agent which I have to identify. Here the options are four. One is Listeria monocytogenes, which is gram-positive bacilli, causes for neonatal meningitis. And the salmonella enteritis, which is a gram-negative bacilli, causes for gastroenteritis, and Staphylococcus aureus, which is a known pathogen and coagulase positive organism, and which is a gram positive cocci and mostly causes for skin infections, bloodstream infections, and also deep-seated infections in the form of osteomyelitis, which is a very common form of deep-seated infection by Staphylococcus aureus, and Staphylococcus saprophyticus associated with UTI, which is also gram-positive cocci. So here the answer would be the Staphylococcus aureus, which is gram-positive cocci and commonly associated with deep-seated infections like osteomyelitis, right? An 18-year-old male presented with acute onset of descending paralysis for 3 days duration, along with double vision and also the blurred vision after consumption of a canned food or tinned food. On examination, the patient has quadriparesis without any reflexes, otherwise called areflexia on stimulus. Both the peoples were non-reactive. The most probable diagnosis is, there are four options are there. One is poliomyelitis, which causes for spastic paralysis, and diphtheria mainly involves the peripheral nervous system, and as a complication of diphtheria, which is a respiratory tract infection, and tetanus causes again for spastic paralysis by producing the toxin tetanospasmin. Tetanospasmin. And here the botulism is produced by the causative agent is Clostridium botulinum and produces Botox, otherwise called botulinum toxin, which causes for inhibition of release of acetylcholine at neuromuscular junctions and causes for flaccid paralysis. So the answer would be the botulism, and which is commonly associated with canned food, and because of improper canning of the food results in the contamination with the spores of Clostridium botulinum, and which can grow in the canned food and produces toxin. Consumption of this kind of food may result in the botulism. Third one is culture medium used for isolation of verocytoxin producing Enterohemorrhagic E.coli. Usually the verocytoxin produced by the Shigella species, especially Shigella dysenteriae, mainly responsible for the production of this verocytoxin, which is more virulent toxin responsible for cytotoxicity. And again, if you see the E. coli, there are five types of E. coli are there associated with diarrheal disease. The enterohemorrhagic E. coli is a very important type, which are also associated with hemolytic uremic syndrome, which may result in hemolysis as well as uremia among the individuals. who are infected with this type. And causes for the severe form of diarrhea, uh, especially in adults, which has to be identified or diagnosed in time. So for this, the culture medium, selective medium is Sorbitol Mac Conkey agar. If you see the only Mac Conkey agar, E. coli, any E. coli can grow on this medium and produces pink colored colonies. Whereas Sorbitol Mac Conkey agar, the sorbitol will be utilized by the enterohemorrhagic E. coli and produces pink colored colonies. On XLD and Deoxycholate agar, the organisms are seen as pale colored colonies. Then the fourth one is, which of the following is a hallmark of shigellosis? Shigellosis means the infection produced by the Shigella species. If you see all except the jejunitis, all can be seen in shigellosis. The dysentery is the main form of presentation in the form of bloody mucus diarrhea, and acute colitis, inflammation of the colon, and produces superficial ulcers in the colon and pain abdomen due to the inflammation of the colon. So all three are present, but the hallmark is the acute colitis, because the other dysentery and pain abdomen can maybe presented in other uh, members of the Enterobacteriaceae, but acute colitis mainly seen in case of Shigella dysentery. Then Widal test is example for which type of the following. As you know that Widal test is very important serological test. This is a serological test for the diagnosis of enteric fever. For the diagnosis of enteric fever, otherwise called typhoid fever. So this can be tested. The diagnosis, I mean, this particular typhoid fever can be tested by using the Widal test. Even though it's reliable, its validity is quite questionable. Still, the people are depending on this Widal test, which is a tube agglutination test. Here, the serum will be diluted in the multiple tubes to avoid the prozone phenomenon. Prozone phenomenon. Prozone phenomenon means antibody excess. If the serum consists of many number of or excessive of antibodies, so the reaction between the antigen and antibody won't give the lattice formation. If there is no lattice formation, there is no possibility for the visible agglutination. So Widal test is a tube agglutination test for the diagnosis of enteric fever. And the next one is the type of lesions seen in enteric fever. And there are some skin lesions also produced in enteric fever, and they are called as the rose spots, which are seen on the back of the patient. The back of the patient, which are macular lesions, are red in color. And Koplik spots also seen, but these are seen in case of measles. These are seen in case of measles in the palate and mucosa of the palate. And blueberry spots seen in some herpes viral infections, and spidery lesions are seen in case of chronic liver disease. Chronic liver disease, like in case of hepatitis B viral infection and hepatitis C viral infection, and any other um, diseases which are associated with venous angiomas. Venous angiomas are seen in case of seen in the form of spidery lesions on the abdomen and skin of the abdomen. Next, in young Kashmiri with a lot of head lice infestation is suffering with fever, chills, rash on the trunks in 3 days, and attended to the medical OPD, which would be the wrong suspicion about this particular condition. If you see the Kashmir is more famous for many number of cases of typhus fever, or rickettsial infections are common in Kashmir. And head louse or head lice are mainly responsible for the transmission of epidemic typhus. This epidemic typhus produced by the Rickettsia prowazaki and very common at the time of uh, famine conditions and also the overcrowding areas. This particular disease or louse-borne typhus fever is common, which is also known as epidemic typhus, which is associated with high mortality and seen in the form of epidemics. So these 3 points are in favor of epidemic or louse-borne uh, typhus fever, whereas the endemic typhus is produced by Rickettsia typhi. It's produced by Rickettsia typhi or Rickettsia felis. Felis. Rickettsia felis, which is also known as the endemic typhus and associated with less mortality. So the uh, mm, uh, wrong answer related to this particular question is typhus fever is the endemicity with less mortality. Then, which of the following viral infections is associated with the Negri bodies? As you know, the Negri bodies are intracytoplasmic inclusion bodies, mainly seen in the hypothalamic area of the people who are suffering with rabies. So these are pink colored bodies on H&E staining, and the size around 20 microns in size, and produced among the people who are suffering with the rabies. And herpes also produces inclusion bodies, but they are known as Cowdery type A inclusion bodies. And influenza and hepatitis B won't produce any kind of inclusion bodies. Remember, the herpes virus produces inclusion bodies in the nucleus of the infected cell, whereas rabies virus produces the cytoplasm in the cytoplasm of the infected cell, because it's a RNA virus which can multiply in the cytoplasm, whereas herpes virus is a DNA virus which multiply in the nucleus of the infected cells. Then, which of the following is a classical sign of rabies? It's a rabies is a zoonotic disease transmitted through mainly through the rabid dogs and rabid fox, wolves, and so many other animals. And this rabies is associated with seizures, hydrophobia, agitation, and severe irritation. But hydrophobia, hydrophobia is a classical sign of rabies, where the people will suffer with and fear of taking water in spite of severe thirst, because when they would like to take the water, it may result in the severe laryngeal spasm, and people will suffer with a severe form of asphyxia like feeling. So that's the reason why the people don't want to take the fear of water, and they don't want to take the water. That is known as hydrophobia, which is a classical sign of the rabies disease. Then which of the following is a killed vaccine for polio? As you all know that the polio has got two important types of vaccines. One is Sabin polio vaccine, which is a live attenuated vaccine, and whereas the Salk polio vaccine, which is killed vaccine. This killed vaccine, this is killed vaccine. And this killed vaccine was not associated with any kind of complications, especially vaccine induced vaccine induced polio. This vaccine induced polio is very common with the live attenuated vaccine, but not with the kill vaccine. So the people are now preferring the kill vaccine when compared to live polio vaccine, even though the immunogenicity is more with live attenuated vaccine when compared to kill vaccine. Based on safety, we are preferring kill vaccine in the place of live attenuated vaccine. Another option here is the BCG vaccine. This is used for the prophylaxis of tuberculosis, and DPT, which is a prophylaxis for diphtheria, pertussis, and tetanus disease. Here, which of the following is a marker for acute hepatitis B viral infection? See, in the acute hepatitis B viral infection, the viral replication will be very high, and so the DNA polymerase levels will be very high in the blood. Whereas in case of acute viral hepatitis, IgG antibodies against hepatitis B core, otherwise called IgG anti-HBC, are not seen there, but they are seen in case of chronic disease. They are seen in the case of chronic stage of the disease. And core antigen, that is HBcAg, never seen in the blood. Never seen in the blood, is confined to hepatocytes only. And anti-HBsAg, that is antibodies against surface antigen of hepatitis B viral, hepatitis B virus, they are protective in nature. These antibodies are protective in nature. They are seen in the body followed by vaccination, or followed by, during the convalescent phase. During the convalescent phase, you can see it, but not in the acute hepatitis B viral infectious stage. Then a 30 years man presented with nausea, vomiting, jaundice for 5 days duration. The serological tests showed presence of HBsAg marker, IgM anti-HBC, and HBeAg. These three important markers. Let us see, and during which condition of the infection we can see this in the blood. See, HBsAg is present as long as the people are suffering with the disease, and sometimes during the chronic carrier state also. And IgM antibodies against hepatitis B core antigen are seen during the acute stage of the disease, and HBeAg are seen when the viruses are actively replicating in the blood of the infected individuals. So, depending on this, based on that particular information, we have to see that what could be the right answer for this question. See, the chronic hepatitis B infection with high infectivity, yes, this is definitely high infectivity, but it's not chronic. It's not chronic because here the IgM antibodies are there against IgM antibodies are there against hepatitis B core antigen, but not IgG antibodies. And acute hepatitis B infection with high infectivity, this is the right answer because the high infectivity HBeAg levels indicative of high infectivity, and presence of HBsAg as well as IgM anti-HBC antibodies indicative of acute hepatitis B infection. And third option, that C, is chronic hepatitis B infection with low infectivity. This is wrong because IgG is absent as well as HBe is present. So it's not definitely it's not fit for this one. And acute hepatitis B infection suggests of IgM and but low infectivity. As long as the HBeAgR levels are there, it never be considered as low infectivity. So that's also right wrong answer. So the right answer is a B, which indicates the acute hepatitis B infection with high infectivity. When the HBsAg positive, IgM antibodies against HBcAg positive, and if the HBe antigens are present in the blood. So the pox virus infects the human beings only. See, if you see all these four pox viruses, so monkeypox, tanapox, cowpox, all are zoonotic pox viruses which can infect the human beings and also the animals. But molluscum contagiosum is the one which can get transmitted through the contaminated environment and produces pink colored umbilicated papular lesions on the mucosal surfaces of either oral cavity or genitalia. And so this is confined only to the human beings, and that's why the molluscum contagiosum confined to only human beings, not like other pox viruses like monkeypox, tanapox, and cowpox. Next, a mother brings her 18-month-old son to community health center with watery diarrhea and vomiting, who stayed in daycare center for the last 4 days. On examination, baby had slight fever the past 2 days and feeling hungry. What is the most likely causative agent? Here, the four options are there. Adenovirus, of course, adenovirus also causes, but it is responsible for the kind of hemorrhagic diarrhea. and vomitings won't be present. And astrovirus and norovirus are mainly responsible for adult diarrhea, but not the childhood diarrhea. So the rotavirus is the commonest one, and which is responsible for the watery diarrhea among the people who are being stayed in a daycare center because of the cross contamination. Then travelers coming from endemic area for yellow fever without vaccination have to be quarantined for how long? So the yellow fever is an arboviral infection uh, which is not seen in India, uh, but this disease, I mean, is very common in the certain countries like US. So those countries have made mandatory for the vaccination against this particular disease, that is the yellow fever. So the people who are flying from the country, other countries than US, the US government, not only US, many other countries where the disease is endemic, they made it mandatory to receive the vaccine against the yellow fever. So the incubation period for this yellow fever is 2 to 6 days maximum. 2 to 6 days. So that's the reason why the people will be quarantined for about 7 days. 7 days once they reach the airports and to avoid any spread of disease to their community. Then which of the following is false about Japanese bee encephalitis? You all know that Japanese bee encephalitis is endemic in India, and government of India also made mandatory that everyone should receive the Japanese bee encephalitis, especially during the months of October, November, and December, because of the high mosquito density during the rains, and it's caused by flavivirus. That's also right answer. And man is the dead end host. That's also right answer, because this virus can't get multiply vigorously in the blood to reach such a load to infect the mosquito or to transmit through the mosquito to other human beings. So the man is a dead end host for this particular virus, but this virus resides in the reservoir hosts like pigs and the wild birds like herons. Then herons, and they act like what we call reservoir host. So the mosquito will bite these animals or birds, and after receiving this virus, they bite the human beings. Not only human beings, even the horses and also the other mules. So this from here it won't get transmitted to the other human being, and from mosquito to human beings, once they receive the virus from the pigs or herons, is a possible mode of transmission. And here the vector is the Culex mosquito, not the Aedes mosquito. So the wrong answer is Aedes mosquito. The vector is the wrong answer as far as the Japanese bee encephalitis is concerned. Which of the following is causative agent for black pedra? Black pedra is a superficial skin infection produced by the pedra harte. That is pedra. That is pedra harte, and this mainly produces nodular lesions. The lesions are seen in the form of nodules and the hair, and the long hair, and also the people who won't maintain the proper hygiene to their hair. So this pedra harte produces the mm, black pedra, which is superficial fungal infections. Of course, malassezia fur also, malassezia species of fur mainly causes for dandruff. It may cause for dandruff. And trichosporan, that is an yeast, and anthrax is bacterium. So pick up the dermatophyte, which produces pencil-shaped macroconidia. If you see the dermatophytes, there are three genera are there in the dermatophytes. One is Trichophyton genus, Microsporum genus, and Epidermophyton genus. And here the trichophyton produces pencil-shaped conidia like this pencil-shaped conidia are produced, whereas microsporum produces the boat-shaped or otherwise called the pear-shaped conidia are produced, and whereas epidermophyton produces a club-shaped like this, the club-shaped conidia are produced. These are all multicellular uh, club-shaped macroconidia produced like this. The different genera produces different macroconidia. Trichophyton produces pencil-shaped conidia. Microsporum produces boat-shaped or pear-shaped conidia. Epidermophyton produces club-shaped conidia. Macro. Which of the following parasite is responsible for cerebral malaria? We know that there are four important species of malaria. Plasmodia are there to produce malaria. Recently, the another plasmodium species also was identified from the monkeys. Anyhow, here the cerebral malaria uh, was mainly produced by, produced as a complication of Plasmodium falciparum malaria. And vivax and malaria are responsible for the relapsing disease, whereas falciparum is responsible for recrudescence. Recrudescence of the disease. This recrudescence is due to the reactivation of this plasmodium species, which resides in uh, the capillaries of the internal organs. So the secondary infection is not necessary. Even improperly treated primary infection itself responsible for recrudescent malaria, which is more dangerous in the form of cerebral malaria and also other form of malaria like algid malaria and other forms. And for this, the best treatment is artemether. Artemether is the best treatment for the cerebral malaria, which would be manifested in the form of seizures and coma. Then 20th one is the identify the parasitic infection causing vitamin B12 deficiency. If you see all the parasites shown here, the Ascaris, Tinium, Diphyllobothrium latum, Trichuris trichura, all can produce some kind of vitamin deficiency and also the malnourishment, which results in the anemia. But vitamin B12 deficiency mainly is seen with Diphyllobothrium latum, which is a fish tapeworm. This is a fish tapeworm. This fish tapeworm are mainly responsible for vitamin B12 deficiency.